Federal authorities could approve COVID vaccines for children ages 5 to 11, but some parents are planning to wait. A new survey by the Kaiser Family Foundation says 3 in 10 parents plan to take a wait-and-see approach. 27% of parents will get their children vaccinated right away. The survey found a large majority of parents are worried that not enough is known about the long-term effects in children. Joining us live now is Dr. Peter Chin Hong, infectious disease specialist at UCSF. Doctor, thank you so much for joining us.
Always a pleasure, Liz. Thank you.
So what would you say to parents who have concerns about the vaccine's long-term effects?
First of all, I would say that I definitely understand where they're coming from, but I'd like to bring the science in so far and the experience that we've had in adults to say that there's been no long-term effects that we've seen. In fact, the opposite. You can get long-term effects from COVID, from natural infection, but not from the vaccine as we know it. So I'd start off with that and then engage with them with a conversation. I know that sometimes with people, it takes a series of meetings before people get convinced, and we can move on from there to address their specific concerns.
You know, one concern that was discussed a lot with the FDA and CDC and all medical experts, for that matter, who worked on this panel, was this concept of myocarditis. Can you explain what that is and if that's something that people should know about and should be concerned about?
Yeah, so myocarditis is an inflammation of the heart. And there's also something called pericarditis, which is the inflammation of the lining of the heart, kind of like the saran wrap around the heart that the heart beats in. And these have been observed in a small number of particularly males who were around the age of 30, and was observed more after the second dose of vaccine. But it's still relatively rare in the setting of like maybe 12 to 50, depending on the series you look at, per million people. I would say that it definitely is something to look out for. The vast majority, if not all of the people who had this inflammation did well, actually went back to school or work in about median of 5 days. The other thing I would say about the kid vaccine is that it's probably dose dependent, and because the kid vaccine is 1/3 the dose of the adults, you're taking a rare situation to begin with and a lower vaccine dose, so you're putting rare on rare.
You know, 2/3 of parents that we surveyed said that they're concerned that the vaccine might impact their child's future fertility. Is there any science behind that theory that mRNA vaccines could impact a child's future fertility?
No, this was one of the issues that was probably put around on social media and on blogs and things like that. But actually, it's the opposite. And what I had mentioned about myocarditis is that you can get much more myocarditis in several-fold higher by getting COVID. Similarly, with fertility, there's a much higher impact on fertility if you get COVID by preterm births, by losing miscarriages, losing babies, versus no evidence at all in the vaccine. In fact, there have been studies comparing people who've been vaccinated to unvaccinated, and there have been no differences in any of these outcomes. And when you look at pregnant persons who've had COVID, there's a much significant risk of losing a baby, essentially.
Do you think that the fact that these vaccines are getting approved for younger children, that really is the sign that we're very near the end of this pandemic?
Yes, this is the missing link. I would say that there are 2 other small studies that we're hoping to see before the end of this calendar year, and that's in ages 6 months to 2 years, and then 2 years to 5 years. And that will be the complete circle, the circle of life, so to speak.
So to speak. All right, Dr. Peter Chin Hong, always a pleasure speaking with you. Thank you so much.